Nasociliary nerve. As you know, nasociliary nerve is one of the branches of ophthalmic division of trigeminal nerve. We have studied ophthalmic nerve with trigeminal nerve and its two branches, lacrimal and frontal already, and today we will study the nasociliary nerve. Nasociliary nerve enters the orbital cavity through superior orbital fissure on the lateral aspect, where a ganglion, parasympathetic ganglion called ciliary ganglion, is suspended with it. Then it crosses the optic nerve from lateral to medial side and then run along a medial wall of the orbital cavity. During its course, it gives first of all communicating branch to ciliary ganglion, then 2 to 3 long ciliary nerves which pierce the sclera to enter the eyeball, then posterior ethmoidal nerve which passes through posterior ethmoidal foramen in the medial wall, and two terminal branches, anterior ethmoidal nerve and infratrochlear nerve. Anterior ethmoidal nerve passes through anterior ethmoidal foramen. The course and supply we have done with the nasal cavity. And finally infratrochlear nerve, which is cutaneous nerve, we have already done. So this was nasociliary nerve. Now oculomotor nerve, that is third cranial nerve. Oculomotor nerve is purely motor nerve, as its name indicates. It consists of two nuclei. Number one, motor nucleus, which supply extraocular muscles of the eye, and parasympathetic nucleus, which supply few of the intraocular muscles of the eye. This nucleus is also called accessory Ettinger-Westphal nucleus. Now the motor nucleus is present in the midbrain in its upper level, at the level of superior colliculus of midbrain, while parasympathetic nucleus is present posteromedial to main motor nucleus. Now if we see the cut section of midbrain, we can see the oculomotor nucleus and the nerve emerge through it. So it emerges on the brain stem on the medial aspect of crus cerebri. This part of midbrain is called crus cerebri in the interpeduncular fossa. Now third cranial nerve, fibers from the motor nucleus emerge at the brain stem. Then they enter the lateral wall of cavernous sinus. Within its lateral wall, it divides into upper and lower divisions. Now at this level, nasociliary nerve is present between the two upper and lower divisions, and trochlear nerve, it crosses from lower to upper side in the anterior part of lateral wall of cavernous sinus. Next, upper and lower divisions both enter the bony orbit through superior orbital fissure. Now how they enter through superior orbital fissure? Both upper and lower divisions of the oculomotor nerve pass within this tendinous ring of Zinn, which divide the superior orbital fissure into three parts: central, lateral and medial. Now nasociliary nerve is in between the upper and lower division of oculomotor nerve, and abducent nerve lies infralateral to these nerves, and they enter the bony orbit. In the bony orbit, smaller upper division ascends upwards, and it supplies two muscles: skeletal part of levator palpebrae superioris and superior rectus muscle. Larger inferior division give three branches: branch to medial rectus muscle, inferior rectus muscle and inferior oblique muscle. So oculomotor nerve supply all the extraocular muscles except lateral rectus and superior oblique muscle. Is the parasympathetic fibers which are preganglionic fibers from the Ettinger-Westphal nucleus. They join the oculomotor nerve and travel with it past the lateral wall of cavernous sinus. Then they join lower division of the oculomotor nerve, pass through superior orbital fissure, and then they join the branch to inferior oblique, and it's in its course they reach to ciliary ganglion. From here postganglionic fibers arise, and they supply the two muscles in the eyeball that are sphincter pupillae and ciliary muscles. We will discuss their supply with the ciliary ganglion. Preganglionic parasympathetic fibers from accessory adenoidal nucleus join the oculomotor nerve, then its lower division, then branch to inferior oblique, and ultimately reach the ciliary ganglion where they synapse, and postganglionic fibers supply ciliary muscle and sphincter pupillae. And remember, the fibers, the parasympathetic fibers are present superficial in the nerve, क्योंकि जब हम आगे लीजन्स पढ़ेंगे तो हम देखेंगे कि सिर्फ कुछ लीजन्स जो पार्शियल कंप्रेशन करती हैं उसमें सिर्फ पैरासिम्पैथेटिक फाइबर्स इन्वॉल्व होते हैं. तो आपने ये बात याद रखनी है कि दीज फाइबर्स आर प्रेजेंट सुपरफिशियल इन द नर्व. और एक और बात जो आपने याद रखनी है कि जो लिवेटर पैल्पेब्री सुपीरियोरस मसल था उसके दो पार्ट्स या दो लेमिला थे. जो इंफीरियर लेमिला थी that consist of smooth muscle, that is called smooth muscle of Muller or superior tarsal muscle. It has sympathetic supply. This sympathetic supply also travel with upper division of the oculomotor nerve, and this supplies this smooth muscle part of the levator palpebrae superioris. So oculomotor nerve supply through its motor fibers levator palpebrae superioris, superior rectus, inferior rectus and medial rectus muscle, and inferior oblique muscles, while parasympathetic fibers supply two muscles through ciliary ganglion. These are ciliary muscle and sphincter pupillae muscle.